Hey, everybody. I am very excited about this one, and I have a little story to share. My guest today is Dr. Saundra Dalton-Smith. We've got Dr. Saundra, we got connected through a mutual friend, our friend Mike Kim. And then 2 weeks ago, I got connected with you again virtually without you knowing about it. And it was so cool. I was on a call with some dear friends of mine, and we get together once a month and we just support each other in our business and in our life. And my friend Marie says, she goes, "Oh, I've been working with a rest coach, and you have to take this quiz. It's so powerful. It's by this amazing woman. Her name is Saundra Dalton-Smith." I said, what? And then I say, seriously? She goes, yeah. I go, "Did you know her?" I go, well, I'm interviewing her on my podcast next week. And this literally happened last week. I was just telling Dr. Saundra, I've taken your rest quiz. So first of all, I want to give it, it's a great snapshot of where you might be doing well in your 7 areas of rest and where you might have some things to work on, which we're going to talk about today. So I was introduced to your work, not just looking at your website, but then from somebody who also knows your work. And it was just such an honor to be here. And it was just like such a cool moment for me. So Dr. Saundra, welcome. So Dr. Saundra she is a doctor. She is a physician. She's a CEO of Restorist, which we're going to talk about what that is. And she is an author of Sacred Rest. Good morning and welcome to you.
Hi, Jason. Great to be here with you.
Thank you so much. I'm really excited about this one. So, a lot of the things we talk about in the show are related to mindset and performance. And one of the things we haven't yet talked about in the show is the concept of rest as a way to increase performance. And this is a thing that intellectually, I think most of us know, understand, and we of course feel. And then how many people do you know that say, boy, I'm feeling really rested, or I'm feeling mentally and emotionally and physically rested? And that's one of the things I'll just give a shout out again to the quiz. It gives you some others like creative rest. That's an interesting thing that most people don't think about. So today, Dr. Saundra and we're going to talk about her work around the concept of rest, why it matters, how it is something that we likely most of us don't do enough of, and why it actually matters to get the most that you want out of life. We're not just talking about sleep here, although sleep is obviously a big part of it. So Dr. Saundra, before we get into the topic of rest, I'd love to hear a little bit about your journey. So you're obviously a physician, and you're also the CEO of a wellness company. Let's talk a little bit about your background and what led you to that entrepreneurial journey.
Yeah, so 20 years in clinical practice, that was where I burned out, is about 10 years into it. And actually it was right around the time I had kids. So I was in clinical practice, everything's going well, 50, 60 hours, no problem. And then my husband and I decided that we wanted to start a family. And we had 2 children back to back, very close, 21 months apart. And I had no clue how much work kids were. So it was taking on 2 other full-time jobs. And during that time that I burned out, I still wanted to stay in the profession at that point. So the research, all the work around rest was really a self-preservation opportunity for me. It was just trying to figure out, how do I stay in this very high pressure, high hours career and feel good and actually have energy for my family and my husband. And so that's where the research and all of that began. My background's in biochemistry. So when there's a problem, you research it out.
Absolutely.
And so that's where it started. And as I put out the information, as the book Sacred Rest got published and people started hearing about the 7 types of rest, honestly, it started to take a life of its own.
Sure.
I got to this place where I was getting invites from these corporations to come and train people. And I'm still in my practice full time when this was happening. And it got to a position where it kind of came to a boiling point. And a decision had to be made whether or not to stay full time within clinical practice or to branch out into the unknown with entrepreneurship. And so that's where Restorist was birthed. It's a workplace well-being consulting agency. Doing that now for 5 years. Still do some clinical practice weaved in there more on a part-time basis because I still love that part of it. But I just get to affect so many more people. I mean, when you're working with huge companies, you get to affect so many more lives.
Yeah. Also, a couple other benefits that I would guess is you don't have to deal with the American medical system and insurance companies. And yes, corporations can be challenging to deal with, but you get to go in and bring in your expertise without a lot of the extra administrative things.
So true.
Go ahead.
Yeah, you're absolutely right. So true, because even with when you're sharing something that is not a pill, there's not really a lot of time within a normal physician 15-minute visit to actually share preventative type strategies. So you're absolutely correct.
I want to ask you about burnout. I've had a few guests on, including my friend Ken Morosky was on late last year, and this is one of the things that he talks a lot about as well. I always like to ask folks when they say, and I was burnt out, and this relates to the work you do now. How did you know you were burnt out? Because I hear that in America, and you may know about this more than I do, in America, that term gets thrown around quite a bit. And I have a friend who's German, and she tells me in Germany that is a diagnosis. Like if you you just don't go out and say, "Oh, I'm burnt out." And in America, we're like, "Oh, I'm so burnt out," but people aren't. So, how did you know you were burnt out, or what was that experience like for you?
Yeah, well, that's the thing. The World Health Organization actually does have a classification and some specific checkpoints that you must meet to be able to say that you're clinically burned out. And the
Yeah.
three things include number one is being tired all the time. And so for a lot of people,
Mm,
that's all that they use, that one criteria, and they say they're burnt
right.
out. Number two is that you no longer have joy for the work that you're doing. It's not just that
Okay.
you're overwhelmed, it's that you actually no longer enjoy something that you were passionate about. And
Mm,
number three is that the work that you produce is of a lesser quality of what you know you're capable of. And so
mm.
as a physician, I knew what I was capable of as the type and the quality of healthcare that I provided. And when I saw myself kind of taking shortcuts and I see myself, oh, I don't need to check the labs twice a day on this patient in the hospital. I can check it once a day because that's good enough, right? Well, it's not my standard. So it's not good. It's not the best I can do. And so
Yeah.
when you start seeing yourself checking off those three areas, you're moving into burnout. And I knew for
Mm,
myself that I was going into burnout when I'm a very compassionate, empathic type person. When I got to the point where even seeing and treating sick people was ticking me off, that's a red flag.
mm.
I see so many of
Yeah.
my physician friends and they're complaining about the patients and complaining about the nurses and everything, is horrible. And I get it. Healthcare is hard. A lot of professions are hard, but when you don't even like the people you're serving, that's an issue.
Yeah. Yeah, that's so interesting to think of it. I've never heard it described quite that way with those three different things. And I think in culture, we see this sometimes with musicians and athletes and people that on the outside would be like, well, it would be so cool to play football. But they say, hey, I'm just burnt out. I'm not enjoying the sport anymore. I'm not enjoying playing music, or I'm not enjoying acting. And then they go away. And that's so interesting how that can happen to any of us, even from the outside looking in. Some of those things would be like, well, that would be my dream job, but it wouldn't be. But it doesn't feel that way to them. So interesting. So then you got present to that. And at the time in your clinical practice, you weren't really doing anything around rest specifically. You were just practicing physician, and you hit the wall and you said, hey, there's got to be more to understand about this, is what I'm hearing. And what's the next thing you did then?
Yeah, so that's exactly right. I hit the wall, and I'm an internal medicine physician, which means I have a practice, right? And then I work in the
Yeah.
hospital, the ER, the ICU. And so the way I approached it was I'm tired, so I must need more sleep. I mean, that's what I'm trained. That's how the world's
Yeah,
trained. I'm tired, I
totally.
need more sleep. And so that's where I started. I was like, okay, I got these kids now, and that's what's keeping me from sleeping. I'm going to figure it out and get 8 hours of sleep every single night. And I did that. I found a way to get 8 hours of sleep most
Impressive.
days of the week, and I was still waking up exhausted.
Yeah.
And that's when the red flags went off because it was like, okay, there's something else going on here. I'm getting more than I've never got 8 hours of sleep since before college. So I was getting way more sleep than I'd ever gotten in my entire life. And I was still exhausted. So I started checking all the blood work. That's the benefit of being a physician. I don't have to, I'm
Sure.
in a physician owned practice. I can check what I want because it's my bill, right?
Yeah,
So
right.
I checked all the tests, did even a sleep study, all the things, and I am perfectly healthy. Nothing's wrong with me. My thyroid, my adrenals, my cortisol levels, my I checked everything. And that's a very desperate situation when you have checked all the things that clinically are supposed to help you get a diagnosis and there's no diagnosis. And I knew this wasn't in my head. It wasn't my
Yeah,
hormones, it was not in my
sure.
head. So at that point it's like there's something out there that is not being defined, and I can't take a pill for it because I can't even figure out what it is. And so that was my mission from that point on. Figure out
Yeah.
what this is. And it started with just evaluating, okay, if I'm so tired, I started asking myself, what kind of tired am I? And that's when the game changed. Because it was like,
And
I know I'm tired, but what is this?
And Dr. Saundra, that is an amazing question. How many people have ever asked themselves, what kind of tired am I? You never hear anybody go, I mean, every now and again people go, I'm mentally tired. But most of the people go, I'm tired. And I can say for myself, sometimes I've had the experience too where I try to get good physical rest. But there's times when I'm like, I don't feel like I've gotten a good night's sleep in a year. Because it's not just the sleep, it's the other things. Man, I love that question. My challenge for everybody listening is really think to yourself, what kind of tired are you? And that's going to lead us into talking now, Dr. Saundra, about what you define as the 7 different types of rest. So let's go through the 7, and then I've got some questions about each of those, and we'll just kind of dig in a little bit on those and as we see fit. So your model, there's 7 different types of rest. So first of all, let's define them. What are they?
Yeah, and let me say this. When this started, there was probably like 50 types of rest. Because the way the process began is I sat down, and so when I asked myself that question, I sat down literally with a yellow legal pad and
Oh my
I was
gosh.
just writing okay, what I was basically going through my day, and every time and ask questions. It's all about questions. I was asking myself, what kind of energy am I using for this? What kind of energy am I using for that? Because my thought process was, if I'm using energy, then that can be depleted if I'm not doing something to pour
Mm,
energy back into that same area that is being used. So I was just writing down all the different ways I was using energy. And what I saw was, as I started to kind of group some of the ways together where things were sounding really similar, that's
mm-hmm.
where it came to the 7. So that's where they came from.
Yeah.
And so the 7 types include physical, mental, spiritual, emotional, social, sensory, and creative. And so
Yeah.
each of those, most of them are exactly like it sounds. The
Yeah.
some that people have lots of questions about are the mental and emotional, the fact that I divided those up
Yeah.
because,
Curious
and we
about
can
that.
go into depth with it, but because they're 2 different halves of your brain that are
Sure.
functioning, and you use that
Yeah.
energy in different ways in different situations, from the mental clarity, reasoning, concentration part of the brain
Yeah.
versus the relational, emotional aspect of the brain. So I
Mm.
separated them out because we use the word mental health. However, that's emotional rest in my book, and
Yeah.
the mental is more the clarity and the reasoning.
Yeah, man. I have so many questions about these. So I think if let's go through each of these, and I was going
Okay.
to spark this here. So the physical, I think I'm going to speak for myself. That's the physical feeling of being tired or being tired from exercise. Like actually that your physical being has fatigue of some type.
Yeah. So in sacred rest, the way I break it down is that the physical has 2 different components. It has the
Yeah.
passive and the active. And
Mm-hmm.
the passive component of physical rest includes things like sleeping and napping. And then the active component of physical rest includes all of those things that improve how your body feels, like your circulation, your lymphatic drainage, your muscles
Yeah.
flexibility. So, walk, leisure walks and yoga and stretching and foam rollers and body ergonomics as it relates to your office space. All of those things kind of
Yeah.
fall into that physical rest.
So yeah, the physical rest, which is the one that I think most people talk about when they say they're tired. It's usually either mental, maybe emotional, or physical. So now let's talk about emotional fatigue, emotional tiredness. What
Ye-
is in your research or any other research that's out there, how do we deplete that? Because I relate to these as almost like the 5 love languages where you have a container for each of these things, and
mhm.
either filling them up or depleting them at all times. So let's go to the emotional next. How do we deplete that one? And then of course I'm going to ask you, how might we fill that thing back up?
Yeah. So that's actually the one that I was deficient in. And so it was no wonder I was always tired, because that was the one I had no system in place for actually filling back up. And so I'll give an example. For me, the emotional rest deficit that I developed was from something I call professional emotional labor. And it's
Mm.
easier if I describe this. I'll give
Yep.
an example that probably everybody has experienced first, and then a personal example. The first example would be if you're like we've all been on the plane where someone's had too many of the drinks and now they're like belligerent and they're rude to the flight attendant. And the flight
Yep.
attendant is all smiles, great customer service. Yes, sir. No, sir. And that's not how she actually is feeling. That's not
Sure.
the actual emotion. There's a level of professionalism that's requiring her to be inauthentic with her emotions in the moment to uphold a level of professionalism. Well, we've all experienced that, whether that's you're in
Sure.
customer service or whatever. Well, for myself, as a physician, like I said, with internal medicine, I'm oftentimes in critical care type situations. Well, I live
Sure.
in a small town. So when I see someone in the ICU, this isn't a stranger to me. I'm not a hospitalist. I'm a traditionalist, meaning I see them in the office and in the hospital. So this
Sure.
is someone who's a friend, oftentimes, that's in that bed at the end of life. I'm
Mm.
also an empath, which means that I feel
Oof.
things very deeply. And
Yeah.
so when they're in that bed, that's my friend dying. But you will never see a teardrop from my eye. I will stay 100% professional because that is the role that I must remain in to serve that patient, their family, and my nursing staff. However, there is a professional weight attached to that. I am having
Sure.
to fight everything in me to not release those emotions. That is professional emotional labor. Emotional rest is having a place, a time, a person where I can release and be very authentic, real, and raw about what I'm feeling. Not having
Mm.
to hide them, not having to cover them up, not having to put makeup on them and make it easier for someone else to digest. And a
Yeah.
lot of people don't have that. Sometimes they fear that if they share those things, that it'll be trauma dumping. But emotional
Sure.
rest and trauma dumping aren't the same things. Trauma dumping would be me going to my husband and saying, hey, this is what they were wearing, and this is the color of their gown, and this is what the cancer looked like, and this, and painting this like Netflix picture in his mind so that he gets the running movie of the scene. That's bringing him into the trauma with me. None of us wants to do that with people we care
Yeah.
about. Emotional rest is me is way more raw and authentic and vulnerable than that. It's actually harder than that. It would be me
Yeah.
saying, something along the lines of, I felt helpless. There's nothing I can do. I had,
Mm.
years of training, and I sat there and all I could do was hold her hand. And I wanted to weep, but I had to fight that back. And just being
Yeah.
real raw and vulnerable in the moment. That's where we get the
Yeah.
emotional rest.
And you get the emotional rest back, fills that back up. As you were talking about this reminds me of, I was watching, it's called Homicide. It's on Netflix. And it was about different cases in New York City, like really like scary, like murder cases. And they were interviewing the detectives 20 years later, and they're talking about how you just have to block it out. Like you walk into these things that most of us never see, and you just have to go, I need to put that up, and how exhausting that is.
Mm-hmm.
And how if you don't have an outlet, and to your point, Dr. Saundra, I think there's some positive outlets, and then there's a whole lot of negative outlets there. Drinking, addiction, all these other things that people use to blow off steam that are actually probably make you more tired, but they feel good for a minute, versus what I hear is the healthy of not dumping the trauma, but just refilling yourself by connecting with somebody that's going to hold your emotions because you've done that for everybody else.
Exactly.
So now, yeah. Well, I was going to ask about this one because I know you obviously do a lot of work with corporations. How does this go in the business world? Because people have tons of big emotions in the business world. And most companies I know, it's really not that invited. So I'm really curious now about this emotional one. I think this leads into mental, as the other one people get very tired at work, is how does this relate in the business world? And I want to speak specifically to people that are people leaders that maybe need to bring a little bit more of this to their folks to to drive performance, but also just be good humans to each other.
Absolutely. And this is actually what we do within Restorist. Is that's the love that I'm having right now is that bridge, because what we're finding is oftentimes when we're brought into an organization, we're being brought in during a change status. So there's an acquisition, there's a merger, there's a change in leadership. And the problem is everybody in the company has emotions around it. And
Sure.
unless leaders understand how to engage emotion in a safe space so that people don't feel like their job's at jeopardy, it's very difficult for the company to have any movement. Everybody's kind of on edge. And when people are on edge, there's a mass exodus usually in most companies when that happens.
Yeah.
Because nobody likes the pressure of consistent emotional professional labor. And so we have to help. Primarily what we end up having to do is to help the leaders understand how to introduce the conversation so that you can begin to create those safe spaces. And a part of that is by owning up to what the emotion is. And so saying, rather than trying to act like nobody's stressed, saying,
Right.
I get this is a little stressful, and that there's change that's happening. What are some ways that we can approach this change? And then start helping people by building up some of the soft skills that nobody is trained on in college.
Totally.
So
Yeah,
college
nobody.
teaches us all of the details, and nobody trains anyone on the soft skills of adaptability, communication, self-awareness.
Totally.
These are things that leaders have to know, and to have a healthy team, they have to know these things as well. And so that's a big part of the process, walking people through that, building out wellness initiatives. And I know when I say wellness initiative, people think, oh, you mean like my days off and PTO? Those things are fantastic. So yeah, enjoy all of that.
Yeah.
But I'm talking about actually the interpersonal wellness initiative so that you actually build a healthy team and healthy leaders.
Yeah, thanks, Dr. Saundra. The audience can't see this, but I'm smiling because I heard a story from a client of mine where she works at a large corporation, and they had an EAP speaker come in, like an Enterprise employee. For those who don't know what that is, like employee assistance program, and it was an external speaker, and they were talking about mindset and dealing with change. The advice that this speaker gave was, oh, when you're feeling negative thoughts or thoughts that stress you out, just change your mindset. And I said, that is one of the worst pieces of advice I've ever heard, because if it was that easy, what we just do this all the time, that completely discounts past-based trauma, your feelings about things, and also and what I'm hearing in all of this is, if you're emotionally tired, that's hard to do. That's an easier, changing your mindset. I'll speak just for myself here. It's much easier for me to shift into a different gear that's more, I think, more productive if I'm not feeling tired, mostly because that is a heavy lift. For me, that's a big, and for most people, I'd say that is a big emotional drain that then can source me back up. But I just thought that was so funny that, like, there's so much bad advice out there about change and change management and addressing these sort of things that is so basic and I'm sure you've heard these things too. There's a reason people bring you and your company in, because they're like, this stuff doesn't work. Especially when you tell people, hey, change your mindset. You go, oh, really? Thanks so much. That's really, really helpful. Thank you.
But it's really interesting though, because there's some companies that are killing it. They are
Totally.
They are 100% on board. They understand the process. But one of the probably the biggest battles I find are companies who basically want a quick fix for something that it's no different than me telling a diabetic, you're going to have to change your diet. I can't say that one time and then it's done. I have to give the kind of the 10,000 foot view of why we're doing something. And then we have to actually put it into practice. If it was medicine with a diabetic, I then got to show them some recipes what can you have if you can't have that Snickers? I got to give some options on ways of satisfying a craving or whatever that is to replace it. It's no different in the office space. And so we're oftentimes having to do a little bit of kind of detective work with companies, because they love to invite you in for like the one-off town hall talk. And
we did it.
Yeah, we checked it off.
We supported our employees.
And I always have to let them know that this is the 10,000 foot view. I think what would actually serve them is if I actually get on the ground level with them. And we actually talk about, what do you do when these things are happening? What are the actual strategies and tactics that can be done in the moment, in the middle of their day, to input restorative practices? Because that's what the book Sacred Rest is about. Every single type of rest I talk about, I give 3 different ways of actually implementing it. And there's hundreds of ways, but it's like, let me pick the top 3 that I think people would actually begin to benefit from and take them through the process. Because unless you get on the ground level, it's all just theory. It actually isn't implemented yet.
Yeah. I do coaching work, and I would say awareness is fun, but who cares? Like, oh, so now I'm aware I'm more tired, I have your rest quiz pulled up here because I'm looking at my results as we're talking through this right now. It's like, oh, I realized that I'm a little more emotionally tired than I thought I was. So what? If I don't know what to do with that, then now for me, I'm always like, oh, like something I need to fix, but I don't know what to do with that. So we're going to talk about that in a little. We're going to talk about some of the specific ways to address some of these things. But I want to go through the rest of these too, because they're all so fascinating. And now we're going to get, so we've talked about physical, we've talked about, I think mental and emotional, you said they're two separate parts of the brain, but they're similar in that they come from our brain. Now we've got 4 other ones that I had never thought about, and I'm sure you get this all the time. You're like, oh, I've never really thought about that. So let's talk about spiritual rest score. So when you talk about spiritual rest score, let's define what that means. But the term spiritual in this context, and then what you mean by that.
Yeah, so spiritual rest, it's different for each person, really just depending on what their belief systems are. So
Sure.
at the very core of spiritual rest is the need that we all have to feel as if our life has meaning, purpose, value, that we are giving back to the greater good, that our need for belonging and love and acceptance, all of that falls into spiritual rest. And so whether someone gets that in a faith-based system, a faith-based type community, or if
Sure.
they get that through causes or different things that they are affiliated with. It includes things like volunteerism, the good feeling, so to speak, you get when you've done good to somebody else who can't really do something for you, when you're a voice for the voiceless, or you are, helping and serving in some type of way. That's what I'm referring to. It's that feeling back up that comes. And the thing I think that a lot of people have trouble with when I talk about restorative practices and rest is because oftentimes we thought of rest as cessation, stopping, sitting still. And so our brain says rest. Oh, that's sleep. That's not doing anything. That's sitting around, cessation. But really, rest is about restorative practices. What pours back into that bucket? And so oftentimes it's not just sitting still. It's actually doing something that fills you back up.
Yeah. I mentioned earlier my friend Kent Morosky. He was a pastor for 15 years. And you probably know this and perhaps have talked to people who do church work. Pastors are notorious for getting burnt out. And as I'm looking at this list, I'm like, oh, yeah, that would make sense because they're constantly supporting other people's emotions, constantly giving. And Kent talks about this. He goes, but I wasn't sourcing myself. And so I reached an area of burnout for myself. And for him, the result of having what I would say, and in your quiz, a higher score is like a higher blood pressure. You don't want it. You want the lower score in this one.
You got it. That's right.
You want the lower score in this one, is that he said he ended up on the floor like sobbing after meeting with one of his people in his church, and he didn't know why. And I would assert that that's probably because many of his scores were like, if you're his doctor, you say, these indicators are not good, my friend. We need to get you on some sort of treatment. So I think about that in whatever profession you're in, how some of these things are going to be probably more relevant than others. And that leads me to the next one, which is also fascinating. And I'm a complete extrovert and I love people. And this one is social. So your social rest score. And my social rest score, I spent a lot of time with a lot of people, have 2 kids and a wife. And my social rest score was my second lowest score. So I'm curious about that one. So that one to me seems very dependent on personality, introversion, extroversion. I know people that are like, I think all people are punks and I don't like them. I'm like, I kind of think most people are punks, but I love them anyway. So that one is so interesting to me. And I hear this from clients all the time. He said, I just need a break from the people on my team, or I just need a break from my boss, or I just need a break from the constant like people part of my work. So let's define social and where that one has some variability in it, because that one seems very different depending on the person.
Yeah, it does have some differences, but social rest at the core of it is each of us need to have people in our life that are life-giving, that are actually pouring back into us. Majority of the people in our lives are negatively pulling from our social energy. They need things from us. Gimme, gimme, gimme. Who in your life does not need anything from you? A lot of statistics show that adults have fewer adult friends now than ever. And I'm not talking about COVID. The statistics started before COVID. We're focused on family and work. So that's where we spend all of our time. And oftentimes those relationships can get very one-sided, even within your own home. People can get into a situation where you're always giving and you never are receptive to being on the receiving end within your social relationship at home. So that's really the basis of that social rest, the need to be kind of have life-giving people that are pouring back into you. And so people who are introverts and extroverts, they require different levels of this. Like introverts are really good with being by themselves, but they still need people. All of us need to have those life-giving people. Extroverts need more of those life-giving people oftentimes because that's such a big part of how they get filled up. And so there's differences there. But what I find the biggest difference between introverts and introverts still need those social rest people, but they like fewer of them and they go deeper with them. Extroverts need those life-giving people and they like a lot of them and they tend to not go as deep with them. And they're good with that. They just like the energy around those people.
Yeah, that one's interesting too. When I think of social, I think of there's a lot of psychological things there, like codependency, attachment personalities, where you're like, oh, like I really love being around this person, but do you love being around this person, or are you codependent on them, or are they codependent on you? Which, unfortunately, this isn't something that I experienced, but I know people that would say they're in a codependent relationship. Their social rest score is probably high because they're constantly giving. And I'll say, Dr. Saundra, and I don't know how this has gone for you and your family, but as my wife and I have gotten older with more responsibility in our life, I would say my score has gone down here because we've just gotten rid of the people that just aren't life-giving. Not getting rid of them, but it's got to feel symbiotic for both my wife and I, or it's just not worth it. Because and I wish I could have told myself in my 20s this, I'm like, hey, if that person who calls you up and they don't even ask you how you're doing, and all they want to do is get your advice or get your problem solving, that's when I get tired. That's when my social rest score will go like that. And as an extrovert, I like to feel like it's a give and take. And so I'm curious if people are out there listening, they're like, and they take this and they go, oh, I actually have a pretty high social rest score. What is something that's what's the first thing you'd have them look at in terms of maybe shifting that?
Yeah, if they are in a intimate relationship with someone, or if they have kids, to start looking at because that's probably where they're going to be spending most of their time. To start looking at ways to flip those relationships if they become unbalanced. If they've gotten to a situation where they're always giving and never receiving. I'll give a simple one that I talk about specifically, since most of us have holidays that come up where we're giving people gifts, right? So whether it's Christmas or Father's Day, Mother's Day, whatever. So those holidays, we give people gifts that they probably don't want. They're going to re-gift at some point anyway, because nobody needs another tie or, necklace or something. So what I recommend is make it an opportunity for social rest. So rather than give them another gift, how about when you're sitting around at the dinner table, you take a moment to actually say to that person what it is you admire about them, or what it is you're proud of them about, or what it is, why they're important to you, because that's going to be pouring back into that part of themselves, filling that part of themselves back up. And with couples, particularly if you're any kind of relationship as a couple, to think about, one of the statistics talked about couples spend, when they get together, or especially after they're married, they have lesser time that they have together where they're actually looking in each other's eyes.
And that sounds about right.
And when they look into each other's eyes, it's usually not for the right reasons. It actually showed that they typically only are looking at each other eye to eye when they're arguing.
That sounds about, I just hit my 15 year. That resonates.
And but we fall in love eye to eye, and then we don't look at each other until we're fighting after we get together. And so a social rest switch that can happen there is to actually begin to foster eye to eye contact with your spouse intentionally. Not being weird necessarily, but, having moments where you actually look at each other and talk. And so I always challenge couples to, somewhere in the middle of your day, ask the other person how they're doing. When you first do this, they're going to just say, fine, and keep walking, probably not even having looked at you. Put your hand on their shoulder. Just the mere act of the touch right after the question, it's shocking almost to the system. They will turn and look at you because they're thinking, why are you touching me? Even if it's
what do you need from me?
Yeah, it's like,
what do you need from me right now?
Right. It's like, why are you touching me? And they'll turn and look at you, and eye to eye, ask them the question again. I challenged a group of couples to do this, and it was so funny. I got an email from a gentleman, and he was like, I've never read your book. My wife turned me onto your stuff, and we were doing this challenge that you set up, and we did this. And he goes, "I've never had more sex, more conversation with my
Amazing.
wife in the past." I
Like,
was
where
like,
have you been?
I was he was a fan and he'd never read a thing. He just spent
Oh
moments
my
eye to
gosh.
eye with his wife.
Everybody pay attention to this resonates. Look your spouse in the eyes and just gently touch their shoulder and ask them how they're doing. This is not rocket science. My therapist right now would go, "Yeah, see, I've been telling you this for years."
There you
Sounds good.
go.
Oh my gosh, Dr. Saundra, that's so good. That is great. So, for those of you who, again, I hope everybody takes this quiz because it's awesome, and you have a high social rest score. This one, it sounds to me like there's some pretty tangible and actionable things you can get. And this one you can likely lower with the person you're closest to. That's the fastest path to the highest return is going to be. And sometimes it could be your boss, right? Your boss or an employee for those of us who are married or a child that do that. That one is so cool. And then we're going to move to another one that I never thought of before. And this one made me laugh because this one is called the sensory rest score. And I'm a sensory nut. Like, I am a musician. I love listening to music. I love going to concerts. I like a lot of stuff going on around me. I stare at screens all day, and I live in a house with 2 young children. So there's just a lot of sensory things going on. And my sensory rest score wasn't bad. It's 21, which means there's rest in the scoring system. There's rest, but I could thrive with more. So I was so excited to talk to you about this because I'm like, but I love a million things around me. So what does this one specifically mean?
Yes, you nailed it. It's basically looking at just your sensory inputs and the effect that they have on you. Because
Mm-hmm.
what we're finding is we all live in a sensory rich environment. Our
Oh
world is
yeah.
just sensory rich. And so what we have to look at is what is the effect of all of that input having on you. A lot of people, when they become sensory overloaded, they respond with irritation, agitation, rage, or anger. It's the
Hmm.
same thing that happens. Like, you have small children, so
Yeah.
you take your 3-year-old to a birthday party. He's usually good when you first get there. Like an
Oh
hour
yeah.
and a half in, after the balloons have popped and all the noise and all the party stuff, it's nap time because they're like, ah, it's everything goes berserk. Sensory overload syndrome. The problem is when we're adults, we have the same response. We've just learned how not to throw a temper tantrum. Usually we just get mean. And so we're more agitated, we're more quick, we're more
Mm.
snappy at people. And that's the part of it that we then have to evaluate. It's the same reason that road rage is not a thing typically in the morning. It's usually an afternoon
Yeah.
thing. Because
Sure.
in the morning you woke up from bed, which actually sleep does help with sensory overload because you have
Sure.
6, 7, 8 hours of sensory reprieve. Whereas in the evening, you've heard the phones ringing at your office, or you've heard the elevator going off, or you've been on Zoom meetings or team meetings all day, or your notifications on your phones have been binging. All of this stuff compounds, and then somebody, cuts you off and you're honking your horn because it's ticked you off at the last moment.
Yeah. So what's the science behind sensory overload? Like what does the science say about what's happening in our brain around that? Because absolutely anybody who's been around a young kid knows that happens.
Yeah,
And yeah,
mhm, go
go
ahead.
ahead. No, that was it. I was say yes, of course.
Yeah, that's the thing. It's one of those situations where most of us believe that our brain is not processing it. The thing is, with sensory overload, when we hear these noises, we usually are already concentrating on something else. I'll use
Hmm.
an example. Let's say the example of you're sitting in a team, Zoom, whatever it is, virtual meeting, and you got the 15 boxes, and everybody's got different screens, right? Well, you're trying to concentrate on the person's face in the middle of chaos, and you got all these
Yeah.
screens. Your brain is having to filter all of the other inputs to try to narrow down your attention. Now, all of this is done subconsciously. It's not like
Sure.
you're thinking, let me focus on this person's face, but it's having to filter out this other stuff. Same with if you're in an office space or you're at your home office and the kids are playing, that popcorn popping toy where there's like nonstop noise.
Oh, the worst.
I hate that toy. And so you're
Yeah,
you're
it's the
hearing
worst.
that in the background, but you tune it out because you're trying to focus on your work. Well, your brain is actively working. And when that's nonstop, what happens is the brain gets exhausted because it's running like this background program to filter all day long. And
Sure.
so sensory rest is basically what are the things you do to give your brain a reprieve. It could be as simple as having a set of noise cancellation earphones at your office space where you pop them on for
Mm,
20 minutes just to block out the noise. If you're a parent with kids, you can put the noise cancellations on and leave the door open so you can make sure the kids aren't killing themselves,
sure.
out there, and just block it out. And the thing is, moments of sensory reprieve are often enough to reset and give that kind of
Okay.
that break that the brain needs to just reset a little bit. And then there's
Yeah.
a lot of tactics. Like if you do a lot of virtual meetings, change the back screen. If you're a leader of a team, this is a simple one. If you're a leader of a team, give your entire team a virtual background that is uniform so that when you have your team
Yeah.
meetings, it's as if you're in an actual room together. Because if you were
Right.
in a room together, there wouldn't be 15 different screens, colors and things on the wall.
Brilliant.
So just unify it so that it has more of a calming effect.
That's brilliant. I do a ton of trainings, virtual trainings, where we're screens of up to 75 people. And as the person leading those trainings, I'm thinking about it is interesting to see all the different backgrounds. And I know I get curious about it. And I think I'm probably curious about it subconsciously, even when I'm like, nope, I'm busy. I'm busy focusing on leading this room. But my brain somewhere is filtering out, well, that person's in a factory and that person's working from home. Oh, that's so fascinating. Yeah, like make it so we're all in a room. Man, that's a great example of something that we can all do. We can
Simple.
all do. Simple. We can all do. Leaders out there, you want to just try it. Yeah, even like a black background or something that's simple. And most of the bigger companies, they have one.
Mhm.
They come up with a virtual background with their branding on it. So now we're going to move to the last one in this seven part framework around rest scores, and that is your creative rest score. And I love this one too, because for 42 years of my life, I related to myself as not creative, limiting mindset. And then about 4 or 5 years ago, I cracked that thing open and I relate to myself as wildly creative. And my creative rest score was pretty good. It's definitely in the rest but could thrive more. What are we talking about when you say creative rest score?
Yeah, I love how you began that because I think this is the one a lot of people brush off as if, oh,
Yeah.
I don't need
I'm
that
not
one.
creative.
And
Yeah.
then when it comes back the highest, they're like, I get the email. What is this?
What do I do with this?
So yeah, creative rest. Well, let me begin by just saying, by agreeing with you because I feel like that's the thing. So many of us don't think of ourselves as creative because we
Yeah.
think creativity is just you're an artist, you're a musician, you're
Yeah.
whatever. But really, all of us use quite a bit of creative energy just because problem solving is a creative process. So
Sure.
anytime you're having to get schedules to mesh, that's a creative process. Trying to figure out how to, if you're in graphics or marketing, all of these things. And so we use a lot of creative energy. And what creative rest is, it's the rest or the feeling of restoration we experience when we allow ourselves to appreciate beauty and we let it birth and ignite creativity and
Mm,
innovation inside of us. And so this is
mm.
the number one thing I now get invited into companies with when they feel like innovation has ceased. And it's like our
Yeah.
team says they're burned out. They can't think any great thoughts anymore. And we have to discuss what does it look like to actually ignite creativity inside of someone. So there's lots of literature that is coming out because it's a fairly new concept for a lot of people. But
Yeah.
one of the things is that over about 60 to 70% of people experience creative rest around bodies of water. So nature has a
Yep.
tendency to make people
Oh
have
yeah.
this like awe and wonder experience. Some do it in the mountains, everybody's different. That's the beauty of it with all of these
Yeah.
types of rest. It's different for different people. But then if you don't get it from nature, then we have the people who get inspired through art and music and dance and theater
Yeah.
and poetry and all these different things. And it's a matter of actually having people realize the value of that within their work. Entrepreneurs use an excessive amount of creative
Oh
energy,
yeah.
and they're typically the ones who say, I don't have time for fun. Well, you're not going to get very far because you're not going to
No.
be able to think greater thoughts if you don't have something igniting them. And so I think it's really important to see that there's value in the things that actually spark and create creativity inside of you.
Mm. So we've gone through the 7-step framework here, and I'm sure there are people thinking to themselves, this is brilliant and I'm tired. So first things first, read the book. That's pretty simple because as you talked about, Dr. Saundra, you give some things people can do with this. I'm also going to say, and I've said it a number of times, take the rest quiz. It's awesome. The link for that will be in the podcast notes. It's awesome. So Dr. Saundra, I think I want to wrap for now around where do you see this field going and what's next for you around thinking around this? Because like you said, this is not a topic that a lot of people talk about in the business world, even the medical. I can't remember the last time I've ever gone to my primary care physician. They're like, how's your rest? They might say, how's your sleep? But that like nobody, or they might say, how are you feeling? But there's never any like real digging in on what's actually going on. And to your point, a lot of times when you went through that for yourself, a lot of times, hey, I'm tired, they go do blood tests, or which obviously fatigue can be a sign of serious actual medical conditions, but it's not always. So where do you see this field going, and what do you think is what do you see as like the next thing that might be learning for you and for your company, and then because we're getting to know you, that we all get to benefit from that as well?
Yeah. Well, I did a TEDx talk a few years ago, and at the end of the talk, I challenged the world to step over into a rest revolution. So that's really kind of my focus, because we spent the past, 10 years talking about a sleep revolution, and we're more burned out now than ever. Because what happened is we started thinking sleep and rest are the same thing, and they're not.
Yeah.
So we have people focusing all of their attention on the physical component of rest and ignoring these other 6. So that's a big part of what I'm doing, trying to change the mindset around what rest is, getting people to see it as restorative practices and not just cessation. And then on top of that, also helping people realize that if we want to have a better world, we want to, have people enjoying their lives and have people actually producing at the highest level of their capacity. We can't just have a work ethic. We also must have a rest ethic, because they work hand in hand together.
Yeah. I think I want to leave with this it goes back to the question I had earlier. Now that we've kind of laid these out, I'm listening and I'm a leader of people. Might be a founder, might have individual contributors or anything in between. And I know my people are tired. I worked in sales for 20 years. You get tired, especially at the end of the quarter when numbers are happening. Or you're listening right now and you are an administrative at a medical clinic, and you know that your nurses and your physicians and the admin staff, they're tired because it's end of the year. What's something that as leaders that have an influence on this, how can we encourage people or inspire people and support people to do this for themselves? Because my experience, Dr. Saundra, is that people are not reliable to do these sort of things for themselves. Because there's a million other choices we can make instead.
Yeah, I love that. I would say, if you're a leader, then lead. I think part of it is you have to realize that because they don't know this, you're going to need to lead by example. So you can't say you need to get more rest or be more self-aware, and then you're not doing it yourself. There's a level of personal leadership that has to take effect. And that begins with the leaders, the CEOs, the managers, the directors, all of that. Every time we work with a company, it tends to begin with an executive leadership meeting. Because if the leaders are not on board, you can forget it. It's not going to go into company culture. It starts with you, and it starts with realizing that this isn't something most of you are trained in. So leave the ego at the door. It's not like you're doing anything wrong. You weren't trained in it. There's permission to learn. And so as you're learning it, then you can apply it to your team. And I think a part of that is just helping companies integrate it so that the leaders learn first. And step by step, as you go through these 7, you begin to layer it out into your company.
That's beautiful. Dr. Saundra, thank you so much for your time, for the brilliant work you're doing. It's been a pleasure to have you on and talk about this. I've done over 200 episodes in this podcast, and this is the very first time we've talked about rest, I think, in any way other than like very basic. So I just want to personally thank you for the work you're doing. It's so cool to see this, and I'm confident that this makes a difference for companies. And I'm going to leave here. For those who heard her part about the guy, look your spouse in the eye, touch their shoulder, and ask them how they're doing without expecting anything in return, and you will be amazed. Saundra's like, if nothing else from this, I can guarantee this is going to go better for you. So thank you so much for that. Congratulations on everything you've been up to and you're going to be up to. Such a pleasure.
It's been a joy to be with you. Thank you.
Thanks, Dr. Saundra.
Thanks for listening to another episode of Talking to Cool People with Jason Frazell. If you enjoyed today's episode, please tell your friends. Follow us on Instagram and Facebook and give us a shout out or take a moment to leave a review on iTunes. If something from today's episode piqued your interest and you'd like to connect, email us at podcast@jasonfrazell.com. We love hearing from our listeners because you're cool people too.